a silent threat, the prevalence of high blood pressure. High blood pressure or hypertension affects millions worldwide. In the United States, 1 in 3 adults have high blood pressure. Many are unaware of their condition. It's often called the silent killer due to its lack of symptoms. Untreated, it can lead to heart disease, stroke, and kidney failure. High blood pressure strains and damages arteries. This increases the risk of various health issues. Understanding and managing high blood pressure is essential. Proactive steps can reduce the risk of complications. Understanding high blood pressure, the silent killer within. Blood pressure is the force of blood pushing against the walls of your arteries as your heart pumps blood. It is measured in millimeters of mercury, or mmHg, and is recorded as 2 numbers, systolic and diastolic pressure. Systolic pressure measures the pressure in your arteries when your heart beats. Diastolic pressure measures the pressure when your heart is at rest. High blood pressure is diagnosed when readings are consistently 140/90 mmHg or higher. The strain from high blood pressure can damage your arteries, heart, and other organs. The dire consequences: heart disease, stroke, and beyond. High blood pressure is a major risk factor for a multitude of serious health problems, with heart disease topping the list. The relentless pressure on your arteries can cause damage and hardening of the artery walls, a condition known as atherosclerosis. This buildup of plaque narrows the arteries, restricting blood flow to the heart. If a blood clot forms and completely blocks blood flow to the heart, it can lead to a heart attack. Stroke is another devastating consequence of uncontrolled high blood pressure. The weakened arteries in the brain are more susceptible to rupture or blockage, interrupting blood flow to brain cells. This deprivation of oxygen and nutrients can cause brain cells to die, leading to permanent brain damage, disability, or even death. The kidneys, responsible for filtering waste products from the blood, are also vulnerable to the damaging effects of high blood pressure. High blood pressure can damage the blood vessels in the kidneys, impairing their ability to function properly. Over time, this can lead to kidney disease, kidney failure, or the need for dialysis or a kidney transplant. Unmasking the culprit's risk factors for a high blood pressure. While the exact causes of high blood pressure are not always clear, several risk factors can significantly increase your chances of developing this condition. Some risk factors, such as age, family history, and race, are beyond your control. However, other risk factors, such as lifestyle choices, can be modified to lower your risk. Age is a significant risk factor for high blood pressure. As you age, your blood vessels naturally become less elastic, making them more susceptible to the effects of high blood pressure. Family history also plays a role. If you have a close relative with high blood pressure, you are more likely to develop it yourself. Certain racial and ethnic groups, such as African Americans, are also at increased risk. Lifestyle factors play a crucial role in the development of high blood pressure. An unhealthy diet, particularly one high in sodium, saturated fat, and cholesterol, can contribute to high blood pressure. Lack of physical activity, obesity, and excessive alcohol consumption are also major risk factors. Section 5. The power of prevention. Taking charge of your health. While some risk factors for high blood pressure are beyond your control, there are many things you can do to lower your risk and maintain healthy blood pressure levels. Prevention is key, and it starts with adopting a heart-healthy lifestyle. Making simple yet impactful changes to your daily routine can make a significant difference in your long-term health. One of the most effective ways to prevent high blood pressure is to adopt a balanced and nutritious diet. Focus on consuming plenty of fruits, vegetables, whole grains, and lean protein. Limit your intake of saturated and trans fats, cholesterol, sodium, and added sugars. These dietary changes can help lower your blood pressure and improve your overall cardiovascular health. Regular physical activity is another cornerstone of high blood pressure prevention. Aim for at least 30 minutes of moderate intensity exercise most days of the week. Engage in activities you enjoy, such as brisk walking, swimming, cycling, or dancing. Regular exercise helps lower blood pressure, strengthens your heart, and improves your overall fitness. Section 6. Monitoring and management, your roadmap to a healthy heart. Regular blood pressure monitoring is crucial for detecting high blood pressure early on, even if you don't have any symptoms. Knowing your numbers empowers you to take proactive steps to manage your blood pressure and reduce your risk of complications. Make it a habit to have your blood pressure checked at least once a year by your healthcare provider. If you are diagnosed with high blood pressure, your healthcare provider will work with you to develop a personalized management plan. This plan will likely include lifestyle modifications, such as diet and exercise, and may also involve medication to lower your blood pressure. It's essential to follow your healthcare provider's recommendations closely and attend all scheduled appointments. Managing high blood pressure is an ongoing process that requires commitment and adherence to your treatment plan. By actively participating in your care, you can effectively control your blood pressure, reduce your risk of complications, and live a longer, healthier life. Section 7. The importance of early detection. Listen to your body. While high blood pressure is often called the silent killer because it often presents no symptoms, some individuals may experience subtle warning signs. It's crucial to be attuned to your body and seek medical attention if you experience any unusual or persistent symptoms. Headaches, particularly those that are severe or throbbing, can sometimes be a sign of high blood pressure. Nosebleeds, while often harmless, can also be associated with high blood pressure in some cases. Other potential warning signs include shortness of breath, dizziness, or blurry vision. It's important to note that these symptoms can be caused by a variety of factors, and experiencing them does not necessarily mean you have high blood pressure. However, if you experience any of these symptoms, especially if they are severe or persistent, it's essential to consult with your healthcare provider to rule out any underlying medical conditions. Section 8. Lifestyle modifications, small changes, big impact. Adopting a heart-healthy lifestyle is not only crucial for preventing high blood pressure, but also for managing the condition effectively. Making gradual yet sustainable changes to your daily routine can have a profound impact on your blood pressure levels and overall well-being. One of the most impactful lifestyle modifications you can make is to reduce your sodium intake. Aim to consume no more than 2,300 milligrams of sodium per day, which is equivalent to about 1 teaspoon of salt. Read food labels carefully, choose fresh or frozen foods over processed options, and flavor your meals with herbs and spices instead of salt. In addition to reducing sodium, focus on increasing your potassium intake. Potassium helps counter the effects of sodium on blood pressure. Include potassium-rich foods in your diet, such as bananas, sweet potatoes, spinach, and beans. These dietary changes can help lower your blood pressure and improve your overall cardiovascular health. Section 9. Your health, your priority seeking professional guidance. If you have concerns about your blood pressure or are experiencing any unusual symptoms, don't hesitate to seek professional medical advice. Your healthcare provider can accurately assess your individual risk factors, monitor your blood pressure, and recommend appropriate treatment options if needed. During your appointment, be prepared to discuss your medical history, any medications you're currently taking, and any lifestyle habits that may be contributing to high blood pressure. Your healthcare provider may recommend lifestyle modifications such as diet and exercise changes, or prescribe medications to help lower your blood pressure. Remember, managing high blood pressure is an ongoing process that requires a collaborative effort between you and your healthcare provider. By actively participating in your care and following your healthcare provider's recommendations, you can effectively control your blood pressure and reduce your risk of complications. Section 10. Stay informed, stay healthy, join the conversation. High blood pressure is a prevalent health concern, but it is also largely preventable and manageable with the right knowledge and tools. By staying informed about the condition, its risk factors, and the importance of regular monitoring and management, you can take charge of your cardiovascular health and reduce your risk of complications. Remember, knowledge is power when it comes to your health. Continue to educate yourself about high blood pressure and share this vital information with your loved ones. By working together, we can raise awareness about this silent killer and empower individuals to prioritize their heart health. To learn more about high blood pressure, prevention strategies, and management options, Subscribe to our newsletter for regular health updates and insights from leading medical experts. Your health is our priority, and we're here to support you every step of the way.